Hey, I'd like to welcome you to another episode of Mission Matters. My name is Adam Torres, and if you'd like to apply to be a guest on the show, just head on over to missionmatters.com and click on Be Our Guest to Apply. All right, so today I have Lee Murphy on the line, and he's founder and CEO of Inspira Health. Lee, welcome to the show.
Thank you, Adam. Glad to be here.
All right, Lee. So I'm excited to get into today's topic. So we'll really be addressing, individuals that have five or more chronic health conditions. And as I was prepping for this interview and doing my research, I mean, I've done hundreds of interviews in the healthcare sector in various areas, but I've never come across this topic. So I'm genuinely really interested to get into it and to bring that to the audience and to also just shed light to maybe some of the people out there that are going through some of these conditions, just to let them know like they're not alone. Like there's a population of people out there just like yourself. So I'm excited to get into all of this, Lee. But before we do, we'll start this episode the way that we start them all, with our Mission Matters Minute. So, Lee, we at Mission Matters, we amplify stories for entrepreneurs, executives, and experts. That's our mission. Lee, what mission matters to you?
So, the mission that matters to me, Adam, is aligning with my values. And so, three of my top values are compassion, positivity, and accountability.
Mm,
And so, I founded Inspira Health with the focus on helping people that are often really struggling, those with five or more simultaneous lifelong chronic conditions.
mm,
Inspira Health believes in the human capacity for change. And to be able to change, you've got to be able to envision a future with improved health, and then one that allows you to a pathway to get to that different future.
mm,
So over 30 years ago, I committed to spend the rest of my life continually deepening my capacity to both love and serve. And by serve, I mean making the planet a better place for my having been on it. And Inspira Health embodies this commitment. Our approach brings compassion first. We create a space where
mm,
people can be seen as unique, special, and whole individuals. They're not a combination of their various conditions like they experience so often in the healthcare system. We want to know who they are. We want to know what's important to them, what we can do to fan the flames of hope for improved health and a better future.
mm,
After that trust building, we use a team approach. We center on in person interactions to help bring that envisioned improved health to reality. Our focus is life behavior changes, how
mm,
somebody eats, how they sleep, how they move, how they manage their health, and how they understand their conditions.
mm,
If you address those aspects and support mental health and address social needs, it's guaranteed to improve the health, if not totally transform the health. You
mm,
still have your conditions. You still have to live your life within the constraints of these, but your conditions do not have you. And that's a big shift. If you move from a life that's constantly reactive and
mm.
seemingly ever more restrictive to one that supports flourishing, that change is transformational.
Oh, this transformational change that's possible in the quality of life. I mean, it's a big topic,
Mhm.
and I want to go further into this. I mean, but before we do that, I'd like to maybe just take a step back. I know you said over, many years ago you founded
Mhm.
and you were on this path. Like where did all this begin? Like, where if there was a point or it was a progression, like how did you know that this was going to be your thing or your mission?
Well, you don't start out thinking,
Yeah.
I want to help people with five or more chronic conditions. I think it started out for me. I started working in a family business. We're a
Mm,
boutique employee benefits consulting firm, and we started looking at data. We were in the business right when claims payment got computerized. And so
mm,
we started to be able to look at data. And what we saw in the data was there's a very small percentage of the people account for a big percentage of the costs.
mm,
And nobody was figuring out how to address that group. And so we probably spent 10, 15 years looking at that group, trying to figure out what to do. And what we came, where this whole business came out of was,
mm,
if you break that small group into three components, I'll
mm,
call them um, tragedies, which are people that have usually a single diagnosis that
mm,
can be catastrophic for their life, accidents, and then people with multiple chronic conditions. The the thing that makes the people with multiple chronic conditions unique is,
mm.
if I look at your data today, I can tell you who's going to be in that group 5 years from now. I cannot
Wow.
tell you who's going to be a trauma or a tragedy. And
Mhm.
so if I can identify this group, then the question becomes, can you build a program to help them change their lives? And so that's how we got into it.
Wow, what an interesting thing that the data you can see what's going to happen 5 years in
Mhm,
advance for a certain percentage of the population. Like that's extremely interesting. But it like if you're starting any type of business, right? Like if you
mhm,
have a problem out there that you're looking to address, I mean, in my opinion, this is the right way to go about it.
mhm,
So you're going out there and addressing. You see the need, you see the population, and then you're going out to address and fix that problem and serve that need. So I mean, it just makes sense.
mhm.
And I guess where my mind, even when I was kind of going through everything for this interview, like where does the five come from? Like, is that a specific number based on looking at the data, or where does the five come from?
So we ended up at 5 for a couple of reasons.
Mhm,
One is that if you look at uh, large amounts of data, the
mhm,
inflection point in looking at claims happens between 3 and 4. With every additional condition, the average cost goes up. That's
mhm,
not a surprise. But that jump gets big between 3 and 4, and that happens
mhm,
in every data set that we look at. And so if I'm looking just at claims
mhm,
data, I would say that the actual number is 4 on just data. I've never had somebody come into our program that had 4 conditions that showed
mhm,
up in claims data that didn't have 2 or 3 more. The
mhm,
actual number average for the groups that we're working with is probably 7, but we talk about it as 5
mhm,
because that's a jumping off point, and it's a
mhm.
point by where that cost gets really expensive. It
Are
also
there
makes it also makes us unique. Nobody else wants to deal with this population.
Hmm. Are there going a little bit further into the idea of the
Yeah.
population? So we know conditions are the, let's just say, the barrier to entry, right? The
Mhm.
five chronic. Are there other similarities that you find when kind of looking at how to help this population, whether it's socioeconomic status or I don't know,
Mhm.
like just in general? Are there any other similarities?
So besides the 5 conditions, and our
Mhm.
conditions aren't just any conditions, they're conditions that can be impacted by lifestyle change. The other piece is
Such as maybe just a.
obesity, hypertension, chronic joint pain, diabetes, asthma. So
Mhm,
things that if you change how you move, how you eat, how you sleep, and manage your stress, all of
mhm,
them get better.
yeah.
Um, we include mental health conditions, but the real thing that's similar is that 75% of the population that come into our program
Mhm,
um, are appropriate for mental health counseling. They could use some additional support, and that's not a
mhm,
surprise because if you've got 5 chronic conditions, you've probably
mhm.
been living with at least 3 of them for
Yeah.
1 to 2 decades. And so
Wow.
picture somebody, and so your life, isn't what you'd like it to be. Your life is a struggle. You don't feel like you have control in a lot of areas. And over time, it can really wear you down. And our healthcare system
Mhm,
is fantastic in so many ways. But
mhm,
in helping people with chronic conditions or multiple chronic conditions that
mhm.
that what they really need is lifestyle change, that's not the strength of our system.
Mm. And so it's a progression though. You said this is like
Yes.
decades. So when I put myself maybe in the shoes of some of these individuals, it's like, okay, something happens in there, and I maybe not to put an age on it, but maybe their 20s, and then it
Mhm.
carries over to their 30s. There's another something that develops, and maybe into their 30s, they now one or two more develop for whatever reason. Obviously, different people, different situations. But
Mhm.
if you look at it, like over decades of this and this pile up, like that's gotta bog down on somebody. Like that's gotta be pretty defeating. I mean,
Yes.
just to wake up and just to go about your day and like your normal thing, you're like, okay, now this comes up and it's adding to these
Mhm.
other issues maybe that I have. It sounds to me like, I mean, it adds up.
It absolutely adds up, and once you have a couple of conditions, the
Mhm.
chance of you getting another one is greater than the
Mm.
chance of somebody getting their first one.
Oh,
And
so it
so
kind of it maybe spirals as well.
it's a positive feedback loop. It's very, very difficult. Yes.
I get it. So now, okay, so we've
Mhm,
established, some of the conditions, right, as you
mhm,
mentioned. So to go back to it, maybe mental. There's some mental issues there. There
mhm,
could be, as you mentioned, obesity,
mhm,
diabetes, like a lot of different other things, specifically for the ones that Inspira Health is working with,
mhm,
among a bunch of others. You've also established that this doesn't happen overnight, like
mhm,
possibly, like somebody doesn't just necessarily wake up and all of a sudden have five conditions. Like this is
mhm,
a progression.
mhm,
So and also now at this point, the person is possibly not feeling so well. They've been dealing with something for
mhm,
decades. So now I guess taking it a step further, somebody comes maybe on the radar of
Mhm.
Inspira Health, or their employer or something else, like where does that part of their journey begin to just maybe understand that there's even some help for them and for this
Okay.
particular population?
So the journey for the individual
Hmm.
starts with the employer contracting with us because we really become part of their health plan.
Yeah.
And so where their journey to us typically begins is they'll get an invitation in the mail. We
Mm.
will have we will have secure access to claims data, and
Mhm.
we will identify people. And like I mentioned before, we can tell you 5 years from now who's going to be in that group because they're in the group now. You don't leave once you're in this group. Um, and-
Can you give me maybe like a little bit more on that? Just a little bit more. So somebody comes into the group, like maybe an example or something like that of where you know.
yeah. So we'll invite somebody in the program. So say they've got
Mhm.
morbid obesity, diabetes, hypertension, joint pain, anxiety.
Yeah.
We'll send them an invitation. Now, it's not unusual
Mm.
that we'll send an invitation and people will ignore it because the hardest part of our program is having our invitation show up when somebody's ready for change. So
Hmm.
it's not unusual where somebody will, um, when they respond to the invitation, will say, I've gotten 3 invitations
Yeah.
over the last 2 years from your organization, and yesterday I was in the store, and I bent down to get a new pair of jeans, and it was on the bottom shelf.
Mm.
And as I bent down, I lost my balance, and I fell.
Wow.
And I realized that when I was on the ground, I didn't know if I could get up, and it
Mm.
was mortifying to me to find myself in that position.
Mhm.
And I thought when I did get up and I got to my car, I said, "You know what? That invitation
Yeah.
I got yesterday, I'm going to call." And so it's really about, it's really magic, if you will, or
Mhm.
luck that the invitation hits
Mhm.
when somebody's ready for change.
And
But
that
that's
example, by the way, that
Mhm,
example you gave, that's very understandable. Like
mhm,
if you're putting yourself in their shoes, it's like, because even just that idea, maybe sometimes of hope, right? Like it's
mhm,
hard to put your hope into something when you've been living a certain way for decades, or grappling with different things, and it's compounded. So if there's obviously the good thing is that Inspira helps. I guess we all have to be sold, right? Everybody's vying for eyeballs.
yes,
So whether it's helping yourself, whether it's buying a new shirt, whether
mhm,
it's whatever, like we all have to be sold. Attention is something that's important. So let's just say, for lack of better words, in my media marketing campaign, a drip campaign, right?
mhm,
To continue to spread love in this
mhm,
case on the individuals that you want to help. I just think it's great. And sometimes, just like I guess, just to juxtapose business and this, sometimes
mhm,
just like your marketing effort and you find the right client, it's kind of
mhm.
the same thing. Obviously, just another product. You're
You
dealing with their life and
you
something and
you've
trying to really help.
you've got to get them when they're ready. So
Yeah.
once we've got a program in place,
Mhm.
some of the ways that it spreads is people tell each other.
Yeah.
And so then they'll call and say, "Hey, can I get in?" And you've got to qualify.
Mhm.
But if you qualify, then yes, and if you're ready to change, then
Mhm.
absolutely.
I maybe let's pause here for a second. And I know we've talked around a little bit around Inspira Health, and
Mhm.
people know what's going on, but like directly, like tell us exactly what Inspira Health does.
So our program
Mhm.
works only with this population, people with 5 or more chronic conditions. And so when you come into our program, you're going to start by taking an online intake, but then you're going to meet with a health improvement coach, and you're going to meet with that person for an hour to 90 minutes.
Mhm.
And then when you finish that, you're going to then go meet with a, a behavioral clinician,
Mhm.
and that's going to be another hour intake assessment program.
Mhm.
And what we're doing there first is we're trying to establish trust. What we're
Mhm.
trying to figure out is, who are you? What's important to you? What's your vision for health in the future? What's worked in the
Mhm.
past? What are the barriers? And how much capacity do you have to engage with change now? Because everybody's capacity is different. If people have lots of chronic conditions and their system's fairly fragile, or they're working 2 jobs, or they've got kids at home and they're a single parent, your capacity changes. So our programs, I could have people with those same 5 conditions that I wrote off before as an example, and our approach with 3 different people will look completely different. It has little to do with the diagnosis. It
Mhm.
has everything to do with how much time they have, how ready are they for change,
Mhm.
where's their mental health, and what are their social needs. Are they struggling to put food on the table?
Mhm.
And there's a level of food insecurity there, or do they have some good support at home, and do
Mhm.
they have the bandwidth to be able to do a couple of changes?
Yeah, it's great. And so the point I like to kind of elaborate on here is it's customized because you want to affect real
Mhm.
change. It's not saying you just go through this and these are the boxes we have to
No.
check, right? It's saying we want to change. So you have to meet the
It
patient where they're at.
it it if the population was less vulnerable,
Mhm,
you could have impact with a great app. There's a lot of companies out there that focus on one condition, sometimes two. They've got a great app. They include a little bit of coaching with it.
mhm,
Our change happens because of one-on-one interaction, people
mm,
helping people. And so we are virtual. We use the Zoom platform,
mhm,
but you're going to get typically an hour a week with somebody, and it's a team that helps you. Somebody's helping you with your overall plan, somebody's helping you with nutrition, somebody's helping you with fitness,
mhm,
somebody's helping you with your mental health.
mhm,
And if there are if you need financial support, we're connecting you with financial support.
mhm,
Um, that's where that change happens with this population.
mhm,
You can't do it with text messages and emails. You've
mhm,
got to hear where they're at, and I've got to walk with them long enough. I can't do this in 6 months. This
mhm,
takes 15 months to 20 months because they have to start the change.
mhm,
They have to fall off the change because life happens.
mhm.
Stress is going to happen. We've all tried to change how we eat, or we tried to change, we want to work out more, and it
Yep.
all works great for a while, and then something happens, and then we're not sleeping as good, we're not eating as good, we're not doing the change in our workout. And what we want to do is be with them when that happens, so then we remind them, when you envisioned your healthy future, is that still important to you? And it's never about, I want to lose more weight or I want to have less pain. It's always about, I want to be alive and dance at my granddaughter's wedding. I want to be able to get down on the floor and play with my
Mhm,
kids. It always is about something bigger than the self that becomes the motivating factor. And we teach them how to continually connect to that. And that
mhm.
creates resilience.
Oh, it's a great story. And I know we've spent quite a bit of time talking about this from the patients, and
Hmm.
I'd like to maybe switch focus a little bit and start talking about a little bit more from the employers and a lot of
Sure.
business owners, a lot of executives, entrepreneurs that watch this, and obviously, everything that we set up to this point, people I feel that are in these leadership positions, they want to help their employees. They
Hmm.
want to do this because not just because it's the right thing to do, but because that also improves the quality of their organization, retention. I mean, we're in a so-called war for talent right now when
Hmm.
we're recording this. So a lot of benefits to putting the employee first, of course. So
Hmm.
aside from that, though, like take me a little bit further down. If as an employer is looking at this
Hmm.
and they're thinking about like maybe some of the reasons that they should be doing this, is there maybe some financial background on this as well?
Sure. So, um, actually, our program will get two, I'll say, two kinds of outcomes. There's more than that, but two that employers like to quantify. One
Mhm,
is we can show health improvement, and we will guarantee at least a 30% health improvement, and that's across 11 different metrics that are fully transparent and auditable.
mhm,
And we will show a reduction in healthcare spend, looking at
mhm,
the spend before you're in our program compared to the spend after. We'll also guarantee a 30% reduction. And so there is a financial piece to it. But more importantly, I think it's the impact that's going to have on the workers' comp, on the
mhm,
disability, on the productivity, and on the ability of that person to engage, not just in the workplace, but in the rest of the community and with their family.
mhm,
Um, and so there is for the right employer, for an employer whose
mhm,
culture and whose their own mission is about really valuing employees and bringing resources to help employees, our program is a great fit.
mhm,
You need to be self-insured, so you have to be an organization of a certain size,
mhm,
and you need to have a longer term approach. This is not. I cannot work with somebody with five or more chronic conditions and tell you, oh, we can turn them around in 60 days or in 6 months or
not
9 months.
realistic. This took
No,
decades. This took
no.
decades. So
It
even to
took
do
10 to
even to
2 to 3 decades to get here.
yeah.
You've got to give them 18 months,
Mhm.
to 2 years to turn it around, and we can do that.
Wow, it's amazing. It's an amazing success story, and it's good to know that that individuals like this have help. Number one,
Hmm.
because maybe that they're not aware, and maybe some of the
Hmm.
employers that are watching this were also not aware. So that's amazing. You mentioned I want to maybe get into the weeds a little bit about this,
Sure.
about what kind of employers typically get the most value. So you said maybe self-insured. Is there like an employee count? Like, give us a feel for that, because at the end of this, I
Hmm.
still have a bunch of questions to ask you, but at the end of this, I definitely want to, leave contact information, stuff
Sure.
like that. We'll put in the show notes. So tell us a
So,
little bit more about that.
so typically, I
Mhm,
would say an employer with 1,000 employees or more,
mhm,
unless that employer is self-insured and they're smaller, and they're not as interested in a specific guaranteed outcome, but what they're
mhm,
interested in is helping their employees. We
mhm,
need at least 1,000 people in there so that we have enough in our program that I can guarantee our impact. And I know if I can get 15 or 20 people in the program, I have no problem making that guarantee.
mhm,
And it's got to be an employer that's got a good relationship with their employees. And quite honestly, people that are willing to take a 2-year approach
mhm,
typically understand and value their employees differently. If there's a union environment, you've got to be able to include them and bring them on board. We've worked with employers with unions in the past, and
mhm,
we can do that. And we're really industry agnostic.
mhm.
And where in the past, I don't know if I'd call it a barrier, but where it was a little bit of a challenge because we use the Zoom platform. We've been on Zoom for 7 years. We used to have to spend half an hour to an hour with every new participant coming in, just
Yeah.
going through how you do that. Today, we don't spend any time on that because of the pandemic. Everybody, unfortunately, knows how to use Zoom.
Yeah, it's interesting how that connectivity
Hmm.
works and how it has worked. And um, going a little, okay. So now, thank you for, by the way, shedding
Hmm.
light on the employer side of
Hmm.
things, because I mean, I like to get into that because I
Hmm.
believe that the numbers make sense in the back end, and why the right employers, it can make a lot of sense
Hmm.
to use Inspira Health and that type of solution. But getting back to maybe the patient side of
Hmm.
things, like, what are some of the outcomes that I know you've been doing this a long time, work with a
Hmm.
lot of populations, but I want to kind of shed some light on this. What are some of the
Okay.
outcomes that you've seen in your experience?
Sure. So we've been doing this a little over 20 years.
Yeah.
And so some of the things that stand out that most organizations aren't able to deal with is we had a person in our program. This goes back a few years,
Mm,
um, but that was really struggling, and we couldn't
mm,
figure out why they weren't able to do anything. And we finally what they finally shared was, well, they're not sleeping well,
mm,
and they're not sleeping well because their husband can't sleep in the bed, so he's sleeping in a recliner because of his back. And the wife was the person in our program, and she's sleeping on the floor next to her husband
oh,
because she doesn't want him to be alone. And the
mhm,
reason they're not sleeping well is because the mattress is so bad that they gave the mattress that they had to their daughter so that their daughter and grandchild could have a good place to sleep. And we looked at that and went, oh, we can solve this. we,
yeah.
we will buy them a mattress.
Mm,
And you think about, health plans aren't used to thinking this way,
yeah.
but you buy them a mattress, and all of a sudden, and she reached back to our coach, literally the next day after the mattress was put in, and she said, I woke up and it was daylight. That hasn't happened in over 8 years. um,
8 years. Hold
and
on.
so,
eight
yeah,
years
8 years. And so you think of the change that
man.
that mattress is going to bring when now you can get some sleep, and now you're not completely chronically exhausted. Your health is going to change. And
Yeah.
so you're able to do things like that. Um, I've got another example of a woman who came into our program, and if you'd have said, okay, what are the red flag issues? What are the issues that this person has to address? They had a lot of them in their
Mm,
care, the care that they weren't dealing with. But as we talked to this person, what we found was, all right, their primary source of calories was the break room at work because they didn't have enough money
mm,
for
yeah.
food. And they were dealing with lots of trauma. And so, the typical approach would be, okay, well, let's get you to close these care gaps, and we need to get you into counseling. And the person said, we don't do counseling. And I went, well, not me, my team went, okay. And so we pivoted. We changed completely. And what she said is, the most important thing for me right now is my medical debt. And it was like,
Mm,
okay. So we spent the first 4 months working with her with one of our resources to build a
mm.
plan to handle her debt. They put that plan together, and she went, okay, you people are real.
Wow.
What do you want me to do? And so, which still wouldn't do the counseling, but
Mhm,
we got her and she changed how she ate. She lost 75 pounds. Her son, who lived with her, lost 50. He wasn't in the program, or
Mhm.
he worked for somebody else, but just that change. And she totally transformed her life. Now, she's still got a ways to go,
Mhm.
but her comment upon exiting to our coach was, "When I came into this program, you cared more about my health than I care about it. I am leaving this program and I care more about my health than anybody else." And that's why we're in this business, Adam.
Oh my gosh, I have chills over here. Like that's when
Yeah.
we talk about transformation.
Yeah.
Like that's transformation. Like I can't even
It's,
imagine like not being able to sleep really for 8 years to have
yeah.
a good night's sleep. I mean, or some of the other things that you mentioned in terms
Hmm.
of like where you're getting your calories, other things like this. And
Hmm.
then I guess this also is a testament to what you mentioned earlier about really meeting the individual where
Hmm.
they're at, meeting the employee where they're at, and not, enforcing this regimen. And
Hmm.
so by building that trust,
Hmm.
it leads to that change. Like it seems like that's the pattern.
It absolutely is. You've got to build that trust. And the thing that I love about our program, and we
Mhm.
we've got hundreds of individual stories. The ones
Yeah.
that I really like are the ones that are multi-generational, is because if you change somebody's health in a system, and that whole system, they tend to share habits.
Mhm.
We've seen it where we're working with the employee who's the
Mhm.
participant in our program, and what ends up happening is it changes their life. It helps them deal with their adult children differently and set
Yeah.
boundaries differently because they're in counseling. It changes the adult children's life.
Mhm.
And then the grandchild who's struggling in school and is a behavior issue, all of a sudden that gets corrected.
Yeah.
And so
I
you
see it.
think about the reverberations that that
Mhm.
has in a community. And that's why when I get up in the morning, I love what I do.
Oh man, I love bringing this to my audience. It's a great story, and I see it. And for the people that are watching this, that are on the employer side, and are in that those decision making, capabilities and
Hmm.
positions, it's something to definitely consider because this
Hmm.
population is definitely underserved.
Hmm.
And then obviously for the let's just say maybe some people are watching this that have gotten some of that mail
Hmm.
from Inspira Health and they haven't responded. Maybe this will help to be the
Hmm.
catalyst to let them know that there's hope, and that there's a way to improve your quality of life,
Hmm.
and you don't have to necessarily go through all the things that you are, and that there's somebody out there that understands
Yes.
that you didn't choose necessarily this, or that you didn't wake up one day with
Hmm.
5+ conditions. Like this was a
Hmm.
progression over decades, and there were many things that led up to
Hmm.
this, and just to let you know that there could be a solution out there. So I think
Right.
it's amazing. So Lee, I just have to ask. I know
Hmm.
lots on your plate, and I know you're
Hmm.
very passionate about your mission and what you're doing. So what's next? I mean, what's next for you? What's next for Inspira Health?
What's next for us is continuing to try to get the message out, is
Mhm.
continuing to try to let people know. First of all, this population tends to be invisible.
Yeah.
Employers aren't used to running reports that said who has five or more conditions. They're used to saying, how many diabetics do I have? How many people with musculoskeletal issues do I have? How many people do I have that are struggling with weight? What they're not used to doing is seeing how many people have five or more. And if there's
Mhm.
any message that I'd like to help people understand, is start to look at this population.
Mhm.
Because if you can see this population, it's going to then create a need that you say we have to do something.
Mhm.
They're not just vulnerable because they've got five or more conditions. When
Mhm.
you look at population health, there's also a direct relationship between levels of income and the prevalence of people with five or more conditions.
Mhm.
There's relationships between race and people with five or more conditions. And if you are really
Mhm.
committed to trying to support vulnerable populations, however you define it,
Mhm.
this kind of a program is a way that you can actually give provide action that's more than lip service, that
Mhm.
says we care and we'd like to help.
Mhm. Well said. So Lee, if somebody's watching this
Hmm.
and they want to follow up and they want to start, exploring what it looks like to work with Inspira Health, I mean, what's the best way for them to do that?
You know, best way is probably to reach out to me on LinkedIn.
Mm,
Reference that you saw the mission matters, so that I can make that connection and make sure to respond right away. But that's the best way to reach out and have another conversation.
yeah.
Absolutely welcome that.
It's great. And to the audience, we'll put the links and all that good stuff in the profile in the show notes so that you can just click on it and head right on over and make that connection. And also check out the website. So we'll definitely do that. And if this is your first time, by the way, speaking of the audience, tuning in to Mission Matters or engaging with our platform, just to let you know, we're all about bringing on experts and entrepreneurs and executives and having them share their mission, like what gets them up in the morning, gets them really fired up to go out there and to make a difference in the world. If that's the type of content that you're into and it excites you, then we welcome you to hit that subscribe button because we have many more mission-based individuals coming up on the line, and we don't want you to miss a thing. And Lee, it really was truly a pleasure getting to know more about yourself, your background, and of course this amazing population that you're helping through Inspira Health. So thank you again for coming on the show.
Oh, thank you, Adam. I really enjoyed this.